Hi everyone, my name's Jed Shlackman. I'm a holistic mental health counselor, also hypnotherapist and energy healer. I've been working in the mental health field for a few decades now and have a variety of experiences and observations that I feel are relevant that people could learn from. And for this video I want to speak about the topic of the future of psychiatry, in particular the future of psychiatry in the context of our modern technologies of artificial intelligence, AI, as well as things like virtual therapy, telehealth, and all the different applications that you can find on the internet, on mobile phones, etc. So there's a lot of technological evolution occurring in the healthcare field, and of course that includes the mental health care field. Now, my perspective in general on psychiatry is fairly critical, so I'll preface everything else I'm saying here by pointing out that regardless of this technological evolution, I think there's significant challenges or difficulties that have been present in the field of psychiatry and mental health care in general. Now this video is for commentary and educational purposes. It's not in any way intended to give guidance for people to diagnose or treat any mental or physical health care concerns they may have. So for those that have particular issues you're concerned about, you can consult qualified professionals to give you some support or guidance with those issues. Here I'm talking about my observations about psychiatry and how things are evolving and how the future will affect the way this field, mental health, is practiced. Something I want to point out here is that when a person comes to see a healthcare professional, they may have a certain belief or expectation about the role of that professional, how they practice, what they actually do with patients to diagnose and treat the concerns that a patient might have. With psychiatry, their role is a little complex because they have training, in a sense, both as a psychotherapist, training in psychology, as well as training in medicine, so some knowledge basically regarding anatomy and medical treatments for physical and mental health concerns. And their specialization tends to be in using pharmacological treatment to address symptoms of mental health concerns. Now, traditionally, going back however many decades you might want to look, psychiatrists leaned a little bit more toward the psychology side, especially in the beginning of the field. They were mainly studying aspects of psychology, behavior, personality, interpersonal relationships, and providing some form of psychotherapy, whether it was psychoanalysis or behavioral therapy or cognitive therapy or humanistic psychotherapy. Psychiatrists early on worked more in that domain, whereas over time, as the biomedical model became more in vogue, we could say, in psychiatry, as the pharmaceutical industry had more impact on the practice of psychiatry and mental health, psychiatrists tended to become more relegated to a role focused on the pharmacological treatment, and patients seeing psychiatrists would tend to see them really just for that, for getting a psychiatric evaluation, a psychiatric diagnosis, and receiving treatment with medications. And other forms of mental health care that people might be receiving would more often be provided by other professionals. So they might see a clinical social worker, a mental health counselor, a psychologist, licensed professional counselor. So all these other different professional credentials in the mental health field would be the ones providing the psychotherapy, while the psychiatrist would tend to really just work on the medical part of prescribing medications. And of course the medications are treating symptoms. It's never claimed that they're actually going to completely resolve or cure a mental health condition. People are usually told that they don't have a cure, that they're just giving this medical treatment to address symptoms of a mental illness. That's the semantics, the paradigm in a sense that's presented to the public. Now, if you look more in depth, you can see that there is a lot of knowledge and research about different factors that can cause or trigger particular mental health issues or diagnoses. But the actual role of a psychiatrist is often not to really address those. They're usually just focused on, okay, this is the diagnosis you have, and as a psychiatrist, this is the treatment we offer. People often say that when all you have is a hammer, everything looks like a nail. So in psychiatry, the hammer they have is pharmacological treatments, psychotropic medications, and the managed care system, in a sense, kind of pushes them toward applying that form of treatment. And a person given a diagnosis may expect a psychiatrist to give medications, and the psychiatrist may feel that that's their role, that's kind of what they're restricted or constricted to be able to share with their patients, and sort of that collaborative expectation ends up in they're just prescribing medicines and not going in depth to provide a more comprehensive therapy model to actually uncover what are the root causes or underlying factors creating the symptoms that have been looked at to diagnose. So people aren't really getting the true issues they have actually addressed, especially if they're only seeing a psychiatrist and not seeing other healthcare providers, either other types of mental health care or complementary and alternative medical type care. In some cases, they're not even getting conventional primary care of the mainstream medical system that might find some medical conditions which in some way contribute to mental health symptoms. So there's a whole spectrum of potential causal factors that could lead to symptoms that are diagnosed as some form of mental illness. Some of those could be physiological things, so you could have physical injuries, brain injuries. You could have metabolic disturbances or hormonal endocrine disruptions. Those things can all affect your nervous system and mental health. You might have exposure to environmental toxins. You might have chronic infections. You might have deficiencies in various nutrients. All of these things can contribute to mental health, in addition to and in combination with psychological and social stresses. So in the mental health field, in diagnosing psychiatric conditions, there is supposed to be consideration of and a history of these different factors in terms of your social environment, past traumas, etc. So these things are all recognized as contributing factors to mental health conditions, to what are diagnosed as psychiatric disorders. But in the application of psychiatry, those are often never really treated, never really addressed. And of course, there may be ones that neither the physician or the patient are even aware of, because there's not enough in-depth exploration or examination occurring. So this brings up the reality that when someone goes to a mental health care provider, they're providing their own subjective report or information about themselves. So they're describing whatever symptoms they think they're having, their own perspective on their personal history. So they're subjectively and not always accurately sharing information about themselves. So it's pretty much all self-report. Much of the time, the mental health care provider, especially the psychiatrist, is not getting to meet with and talk with other family members and accessing other information about this patient that could give additional insight into what's actually going on, what actually might be causing their emotional or mental stress or disturbance. So it's a very imprecise, somewhat unscientific process, you could say. There isn't really a very objective way in which psychiatrists are able to diagnose. There's always some subjectivity there, and it's always somewhat dependent on the insight and accuracy of what the patient themselves is reporting. It's pretty well known that many people will go to doctors or psychiatrists and report particular symptoms or concerns, actually seeking to get a diagnosis and a medication. Sometimes where someone is abusing medications, they'll just learn what they need to tell a physician to get a diagnosis and a prescription. And that happens quite often. It's happening even more nowadays with telehealth, with the doctor not even physically seeing the patient. It's easier to be convinced by whatever someone's telling you to create the paperwork for that and go and prescribe the medication that there might not be really any medical diagnostic justification for. So it's a very imprecise, somewhat flawed process, and that's even starting out with an assumption that there may be a need or value in prescribing these medications for psychiatric diagnoses. That's a different question to look at, but if we even take for granted that giving out the medications has therapeutic value, the process of diagnosing and making those prescriptions isn't being done in a very objective or comprehensive manner. So if you consider that someone could just make up this list of symptoms, report it to a doctor, and the doctor gives a diagnosis and a psychotropic medication, do we really need to have a psychiatrist to do that with modern technology? Someone could just do a bunch of reading on the internet. They could study the subject themselves, look at their own symptoms, enter that information into some type of web form or some type of mobile phone app that can assemble that information being reported and create a diagnostic result. So artificial intelligence nowadays can do that pretty easily, and perhaps in an even more refined way than a human psychiatrist might be able to assemble that information and form their diagnosis. So this presents a dilemma, a challenge for the future of psychiatry, even in the limited way it's currently being practiced, that AI and complementary technologies can actually do the job of the psychiatrist. And if you consider how efficiently they can do it, and that there's no evidence that psychiatrists are actually being any more accurate and effective or beneficial to patients than AI might be, why bother having people going to medical school for all those years, getting those psychiatric degrees, when technology can provide something that creates the same outcome or result? It's something we have to think about and consider, because if the psychiatrist is not doing actual therapy, if they're not building this rapport and providing individualized guidance and compassion and nurturing the patient and helping their patient understand their life history, their experiences, their emotions, how all of this is contributing to their current concern, and what can actually be done therapeutically, psychotherapeutically, not just pharmacologically. So if that psychiatrists currently aren't even doing that, then you might as well just have some application, some artificial construct doing that job. In my point of view, it's helpful to have an interdisciplinary approach to mental health issues, because there are different aspects and layers to the issues people are dealing with. There are physiological and medical concerns, which involve things like nutrition, like toxic exposures, which involve potentially physical injuries. There's many different things that could happen physically that are affecting your nervous system, your endocrine system, that affect the state of your chemistry, your neurotransmitters, etc. And the cause of those issues is not that you're not taking psychiatric medication. Medication is never actually treating the cause. It may temporarily shift the state of your chemistry, but in doing that, you might actually be interfering with or impairing your body's own self-regulation or self-balancing mechanisms. So when that medication wears off, especially if you're using it continually, you may develop withdrawal symptoms, dependencies, or addictions. You might have disturbances to your chemistry that were actually now created by continually taking these medications. So rather than resolving your issues, you might actually be creating new or additional issues. So it's better to work more on the causal level to address biological disruptions, to address psychological stresses, your social environment, your physical environment, different things around you that are affecting your mental health. So that could be your school, your job or workplace, your family relationships. It could be things like what's happening in your country, if there's economic issues happening, if there's some form of oppression or war occurring, if you've had to migrate all these different stresses can affect people's mental health, and they can't be solved or healed by giving someone a pill that just momentarily overrides their chemistry. So we need to really look more in depth for actual healing. If you do just want to give that pill for a momentary shift in what you're feeling in your mental activity, if you want to do what a lot of psychiatrists are doing within this managed care system now, you could do that with AI. Having the human being playing that very limited role doesn't really serve much purpose if they can be replaced with something that's actually more efficient than they are. I'm not suggesting that that's ultimately beneficial, that having an AI do psychiatry or provide therapy is going to provide a boost to people's mental health. I'm just pointing out that the way psychiatry is often being practiced now, you could, in theory, replace it with artificial intelligence. So the psychiatric field, for their own well-being, might want to look at broadening their approach to mental health, not just handing out the pills, but actually looking more at the human element, at the social, emotional, environmental aspects of mental health, and actually addressing those in a way that can't be replaced by technology. So using our power of observation, of intuition, of human relationships, transference and countertransference, etc., all of that can be part of therapeutic or healing process. So we're living in an interesting time where everyone is kind of confronted by changes in technology. There aren't many people or cultures on the planet that are not in some way being affected by our modern technology, by computers and smartphones and artificial intelligence. So we can't avoid these issues. They're something that more and more we'll be facing, and it's helpful to be proactive, to really think in depth and think ahead, to consider things in a more comprehensive, more systematic and holistic way. So for those that are looking for help with mental health concerns, and for those that are practicing in the mental health field, I encourage you to consider the different concerns and aspects of this topic that I've brought up and shared here. I feel there's some value with technologies because they are very great at gathering and collecting information, processing information, so they can speed up some of those processes for us. But we don't want to become too limited by them or dependent upon them, where we neglect other factors or aspects of how we are practicing in the healing arts. For those that are interested in holistic health and wellness, I invite you to view my website, phinsights.com. That's phinsights.com. You can also view other videos that I've created on these topics. And for now, I'd like to wish everyone a wonderful day. Namaste.